coronavirus jàngoro boppam la boo xam ne dina joxe feebar ci anam yi niroog feebaru dënn wala soj. covid-19 mooy jàngoro buñ mujjee jot a yëg boo xam ne coronavirus moo koy joxe. si suñu xeex ak jàngoro ji war nañ di yaatal xol yi te di dimbalante. jàngoro jii di covid-19 xamut xaaj ak seen góor wala jigéen mag wala ndaw dëkkuwaay diine wala xeet. kon warut ñuy ràññaalaate ci képp ku mu mënti doon. ragal ràññaale yi ba ci xaajaloo mun naa tax sax ba nit ki nga xam ne am na jàngoro ji wala sax tukkikat yi ñuy nëbb màndarga yuñ mën a gis ci seen bopp te dina mën a tax sax bañ a dem sàkku ndimbalu wérgu yaram. lii nag dina tax ba ñu bari man cee feebar. ci gox yu bari nit yi nga xam ne ñooy tukki mbaa toxu wala sax dem jàngi am nañ solo lool ci jëm kanamu gox yooyule ak it sax xeex jàngoro jii di covid-19. kon nag ñépp a war a béy seen waar ci xeex ràññaale yi ak dàq bépp xibaar bu wéradi bu jublu ci nit ñi nga xam ne ñu ngi ci yooni tukki. war nañ di bàyyi xel képp ku ñu jege te it ñu leen di dimbale. nañ faral di fàttali wante di raxas suñuy loxo moytu di laal suñuy bët bakkan mbaa gémmiñ ñuy muur suñu xarkanami suñuy tisooli mbaa saxat ñuy sori mbooloo buñ di jege wante te toog ci kër gi buñ feebaree. Gambia nag lañ xamee di Smiling Coast ndaxte suñ xol yaa yaatu. kon nag gën a yaatal suñ xol yi ci xeex noon bu ñépp boole bañ muy covid-19. kon xeex gi xeexu ñépp la. soo si bëggee am lu la gën a leer mbaa nga seetlu ay màndarga yu la jaaxal jokkool ak 1025.
yara ñilla domoro ka diyata
boy janno sikes restaurant
e say nakko be ni na dimbal nimba domoro kala janno
domoro seneyata adiyata topotoro fanan kendema bije luntan during tamala abeka domoro ki janni adi manda wala de te ka we bijele anim fanan ka fadi jang ikono e fa e ka fa minne ko pastry anim bakery iko fanan be kalele badde lomba conference lomba workshop lomba ye fo pendin lo dunia kono domoro betama ñillom international o tewoda number 1
amanke ba domola jandama
e sa domo jang is atariya
wo mu kubandi
sa nakko sa futandin
e oto sa nakko be mu CK's restaurant
dafa nan janna mu yaat ni manje dorom bijam
aban
CK's restaurant, known for best quality food and customer satisfaction.
ko magasin
diwli lanni maaro lanni
fop lanni
awa joni mi anda honno gerdeten e ngal ɗo sabu e ngal ɗo Ibrahima jonnal taw joni mi anda se yahay ka bitiki ñawloɗen ha humpodire e makko est ce que on noon e warude
waɗen noon awa
ane ko de Ibrahima ma ko to woni
mo Amérique
ko Amérique a woni kede humpitaki fiɓe musidɓe men baluwo
baluwo
ɓe andanɗa kala ko wawɗa wonde e aduna o si a rewi e juuɗe maɓɓe a jonnay ɗo dépassement o Gambia hara no weeɓi a yahata kadi taw ko mbuɗi ɗi no ƴawi walla no jippi ɓe haalantama ko kala ko falɗa ko sengo ñamete ili nebba maaro basal pomme de terre kala ko rewi ɗon a hendoto hara no weeɓi kadi wona ɗum ɗon tu ɓe aɓe jonnira e mobile phone siko ɗum kadi laptop kala ko wayrode ɗi hay kaspawa ɓe wawma jonnude kadi sa fala humpitade ko weeɓi ƴettu Google account ma joni data ton waɗa download app maɓɓe on ayiyay kala ko humpima e maɓɓe ton ɓe weeɓi hama
ka wonɗa wo e aduna on
kala ko wawɗa
a jonnanayi wonɗo ka leydi men Gambia ɗo dépense
hara no weeɓi hama si ɗum non fof no neeɓi immoɗen joni mi ɗowtama ka place maɓɓe jano
waɗen joni
iya heɓa ko falaɗa
waɗen kisam
When we touch down, better broke down.
With Gamtel G Fiber, now you can enjoy super fast internet in gigabytes. G Fiber is affordable, stable, secured, and accessible to homes, businesses, and enterprises. With Gamtel G Fiber, the future is speed. Gamtel, creating a brighter future in communication.
That's how she became mine. And see that. Can't believe.
In communication, connectivity is everything. We ensure that the links never sleep. Quantities and qualities, all in our data service, providing efficient, reliable voice and data service. We believe if you're not up to speed, then you're going backwards. Communications have to flow as fast as the speed of light. Whatever business you're in, having someone who understands your needs is critical. That is why we just don't offer you technology, we offer you solutions. Enjoy Gamcel's internet broadband anytime, anywhere. Your national operator, Gamcel, Yaibaram.
Agada.
Mbijan raganyadi.
Albaka.
Mbaka important.
Yo, nga transfer la sto.
Ya transfer la sto.
Ha, code nyenje.
Okay. Korsa. Nsila ID soto.
Ah, sa soto. Sorry. Agada.
Mbijan bro.
Albaka.
Mbaka.
Bara Allah service o tariya.
mbare.
Mo ki janna nun kunu bara tariya.
Jannom yona forest de bureau. Gambia tonkon nano mbari ya bere. Birim koyna fo kato.
Bari si kodo kino kato ni fo bolong blabe ko.
56 branches mola soto Gambia jam.
Ha?
Gambia kono ani Gambia bantala bankol. Nko kono kiya bere. Kodo sifa fo falindiro fo nyaadi lafta même na kodi to poto ni kodi maraw. Jannam number 1 ti nyonta. Andum fana nata anoda enterprise sotale. Wolam nyindi ko domorol fana kol fana be firale de dadi mani domorol dil fana beteat. Gambia dawda yalo ngam fa kendol sotale je.
Wo moy o diat ha.
Apelenta
ni wo ka ni na lafta nyelen kendol e binaji.
Yalo bukani la ko la baraka ba.
Yalo ndel chosano lo.
Abaraka.
Good evening, ladies and gentlemen, fellow compatriots, media practitioners and members, especially members of COVID-19 Media Corps. We welcome you today on behalf of the National Health Emergency Committee under the chairperson of the Honorable Minister of Health, Dr. Lamin Ahmad Samate, on the presentation of the 33rd National Situation Report on his behalf by Dr. Mustafa Bite, Director of Health Services. Dr. Bite.
Good evening, ladies and gentlemen. Once again, we come to do the routine updates. So this is the 33rd National Situation Report since confirmation of the first case of the novel coronavirus in the Gambia on the 17th of March 2020, when the first case was reported in the country. So 30 new laboratory results have been received and all tested negative for COVID-19. The 4 cases who recovered newly from COVID-19 will be followed up for 2 more weeks. 1 new person, a Senegalese national, was intercepted and taken into quarantine whilst trying to sneak into the country through the Jibora border. A total of 99 contacts of the recently confirmed cases traced out of a total of 105. The country currently has 98 persons under quarantine, 3 active cases and no probable case. The 3 active cases are awaiting test results to ascertain recovery status. Globally, since 31st December 2019 and as of 22nd April 2020, a total of 2,634,529 cases of COVID-19 have been reported. Of these, 184,021 deaths were registered and 717,287 recovered from the disease. Senegal has recorded 442 confirmed cases, 253 recoveries, and 6 deaths. Currently, in the Gambia, we have 98 people on quarantine. A total of 397 tests were conducted and 10 are positive. 265 people completed quarantine, 642 contacts traced altogether, and 310 people completed follow-ups. So the daily coordination meetings are ongoing. And on logistics and safety, the following were implemented. A concept note on the establishment of COVID-19 Safety and Security Task Force at central and regional levels are being finalized. Non-infectious waste disposal currently being supported by the NDMA, whereas incinerations of infectious waste is ongoing at the NPHL. Distribution of donated items to regional health directorates is also ongoing. On surveillance and laboratory, the following activities are ongoing. Like we said, 30 new laboratory results received and all tested negative. 99 contacts traced and are currently being followed up for daily routine checks. Newly discharged patients to be followed up for another 2 weeks. On case management component, 4 of the confirmed cases recovered after testing negative for COVID-19 for the 2nd consecutive time. 3 patients currently undergoing treatment at the treatment facility. They are currently awaiting test results to ascertain their recovery and subsequent discharge. Infection prevention and control training of security personnel with medical and clinical background is currently ongoing. Psychosocial support is given to patients under treatment and persons under quarantine and health workers involved. On risk communication and community engagement, the following activities are ongoing. 4 TV and 6 radio programs were successfully conducted. 1 press briefing conducted. 12 communities and 560 households sensitized or engaged on COVID-19 preventive measures using existing community structures. 21 members of the regional committee undergone training on feedback and reporting mechanism of affected populations. Finalization of the regional RCC plan and sub-regional risk communication and community engagement committee TOR ongoing. Summary of social media activities: 2 Facebook and 2 Twitter posts shared with a cumulative engagement of 17,600 people reached. Summary of calls made to 1025. A total of 226 calls received. 214 were COVID-19 related and 12 were non-COVID-19 related. 6 booked for further follow-up by contact tracing teams and 6 booked for further follow-up by contact quarantine team. Regarding our next steps, the Minister of Health will embark on the following. So Minister of Health and the Risk Communication and Community Engagement Committee to work with municipalities on community engagement, fumigation of the homes of newly discharged persons who have recovered from COVID-19, intensify COVID-19 sensitization campaigns in Busumbala and Bundong, introduce a car lock system for the COVID-19 response fleet in order to minimize fuel consumptions, strengthen rapid response teams and contact tracing teams at all regions, establish isolation centers in the major facilities and hospitals, strengthen community surveillance in all regions, especially on designated border areas, continue with the daily follow-ups of low-risk contacts and those discharged from quarantine, encourage public reporting and self-reporting of suspected cases through the toll-free line 1025. We would like to thank all our partners in the fight against COVID-19. Sincere thanks also extended to the Students' Union of the Gambia College and the University of the Gambia in partnering with the Ministry of Health to raise public awareness on COVID-19 in Greater Banjul area. We are also grateful to AfriCell for the support rendered to Ministry of Health. We would like to appeal to the Gambia Ferry Services of the Gambia Ports Authority to continue observing the state of public emergency regulations on public transportations, which emphasized reduction in ferry capacity and avoid congestion in ferries and terminals. We would also appeal to household heads, parents, and caregivers to support and guide children at home and in the neighborhoods. We appeal to them to be active in the implementation of the state of public emergency regulations, including social distancing in their various households. We would like to renew our call for all private and commercial vehicle owners, as well as motorcyclists, to adhere to the regulations in their amended forms. Together, we can fight against COVID-19 in the Gambia. So thank you very much for your kind attention.
Thank you very much, Dr. Mustafa Bite, for that elaborate update and informative. Ladies and gentlemen of the media, men of the media corps, the floor is open for questions. Yeah.
The first question is regarding, we just want to go a little bit back. I think maybe you might be in a better position to talk about the incident at Basse, in where one man was ended up being quarantined, was quite a contentious issue, as reported in the media. Is it only one person up to date that has been tested positive for COVID-19 from Basse? Is Basse clear? That's what I'm trying to find out. Because if this virus is as contagious as they say, then it could be virtually impossible, given the difficulty it took to get that one person.
Have to answer that question?
So thank you. The person, one person who was confirmed from URR was the only one so far. Out of that, we've reported more than 30 household members, close contacts were tested, and they were all found to be negative, and they've done their quarantine, and they are fine. So Yes, it's not impossible because that was an imported case. And if you have a quick quarantine, the people who were very close to them were tested and are not found to be positive. So this is what we can say. So it's not an impossibility. This is what we are seeing happening. Thank you.
Because just a follow-up question to that. The individual, the fourth case was the case which I believe also affected another two.
From Busumbala.
Yeah. And that individual was quarantined and released, but later on got to be found out to have COVID-19. So that individual, all the people that he was quarantined with, were they tested? Then secondly, if he was released and then they got to find out later that the gentleman now has COVID-19, what about all the people that he has been in contact with?
So thank you. The fourth case is actually just being released. He was never released. So the fourth case came and was tested. When he was positive, he was taken to the treatment center. And he has contacts. Among his contacts who were put at the quarantine, before their time for release was up, they were tested. And among his contacts, 2 of them were found to be positive. And they were also brought to the treatment center. So it's not that he was one of the people who were released to go home and come back. His was an imported case, and when the symptoms were noticed, he was tested positive from home. He was taken to the quarantine center. Now it is the contacts that were with him, a big number that were taken for quarantine, and when they were about to be released, they were tested. And among those contacts, they found out that there were two positive ones, and those ones were taken for treatment. And we are happy to say that this one is amongst the ones being discharged now with his 2 contacts. So there was no release of him. And in this situation you are talking about has happened. That is in some of the cases that came from the UAE, where, yeah, so, yeah. Yeah, so that has happened, but that's not the fourth case. So those were the subsequent cases, but yes. So that has happened. When they came, they were quarantined, like they came from hotspots. They came in but did not have any symptoms, so they were quarantined. So after being quarantined for the period, because after quarantine, usually before you have to go home, we've explained that here many times, that when they release you, because that's what the protocol said, but when we decided that now we are going to do this, when we become very progressive, even though that's not the guideline, but we as a minister said this is what we are going to do, so we called back those ones who were discharged. And when we tested them, we found out like 2 of them were positive and 1 of them was inconclusive. So their contacts were traced again, and those are the new ones that are being quarantined again. And then before they are released, they will be tested. And if they are negative, they go home. If they saw any time during their quarantine, if they saw symptoms, they will be tested. And if they show symptoms, they will be tested, and if they are positive, they will be taken to the treatment center. But throughout the quarantine, if they don't show any symptoms, at the end, they will be tested, and if they are totally negative, then they go home. Thank you.
Anybody that is going to be released will be tested?
Yes, that's a policy now, and that's going on. So that's why the 2 that were found to be positive were in quarantine, because it was time for them to go. So a big number was tested, then 2 were found to be positive. So then the following day, the others were released, then the other ones were taken for treatment. Thank you.
Thank you very much. Just as doctor said, that once they are released in quarantine now, they will still be follow-up, with this testing. Any additional question? Yeah.
Law enforcement agency ñoom itam lu bari ci seen liggéey itam xal na slack lu maanaam pour enforce yenn emergency regulation laws yi nga introduce ni biñ laajtee ñenn itam liñ dee wax mooy ñoom it dafa am fi seen doole em muy maanaam comme li nga waxee ports ñun dem nañ fa def fa investigation gis nañ ne social distancing benn amut foofu ci seen waiting room bi tam dañ dee congest foofu tam a lot féeri bi tam daf dee xaare mu mel ni féeri bi ci boppam tam ci seen biir amuñ that social distancing bi ñoo wax biñ leen laajtee liñ wax mooy ñoom all the regulations yi nga xam ne yooyu lañ war a def muy matuwaay yi ñu war a def pour gis ne place bi mat na pour yóbbu ay nit mut na ci ñoom waaye pour gis ne enforce nañ lii tam loolu du seen liggéey ndax Ministry of Health tam mu ngi xalaat naka la moo doolelee enforcement agencies yi nii pour ñu mun a def seen liggéey régulier beneen tam mooy ci mbiru wér-gu-yaram lañ nekka surtout ñu ngi ci problème yi coronavirus bi muy jàngoro bi nga xam ne ci mbiru set la gën a amee doole ñu gis ne ñiy jaay mburu yi nii muy local tapalapa yi and so on ñu bari ci ñoom distributeurs yi rider lañ koy use te seen beer hands yooyu lañ koy use tam di jëlee bread bi di ko jox tam boutique yi tam ñu gis ne tam kuy jaay saabu kuy jaay leneen di seem loxo yooyu lañ koy use tam di ko laalee mburu yi tam ndax amut ay matuwaay yi ngeen foog ne war ngeen koo teg in place tam pour jàppale ni ñu mun a aar suñu bopp ci
Thank you very much, doctor.
jërëjëf si laajte yi am na solo waaw comme niñ ko waxee nit ku nekk nguur gi joxe na ku nekk sa doole si luwaa bi nga ko dee jëlee waaw loolu yëpp mu ngi si luwaa bi ñena ko war a enforce ak waaye ku nekk am nga si cër ku nekk am nga si cër mun ngaa seet naka ngay comme borom bitig bi sax mun naa wax su nit yi ñëwee place am ne nii ngeen naa rangee mu def fa ay line ne kii su taxawee fii 1 meter kii taxaw fële 1 meter so ñun ñëpp dañu am rôle ku nekk am na lu mu si mun a def net kenn warta toog di wax ne lii nekkul suma yoon lii nekkul suma poor moo tax waaye sooy xelal nit yi sax baax na so waruñoo egga bi fu nga xam ne dañoo wax sax di ñu forcer ñun loolu gënut pour Gambie bi lu gënoon mooy soo ñëwee si port bi nga war a dem si féeri bi nit yi seen boppa wax ne lu gën pour ñun si suñu health mooy ñu amal meewante 1 meter ñoom seen boppa suñoo rang ñu def 1 meter waruñoo xaar pour ñu ñëw forcer ñu def loolu parce que lii dafa baax pour ñun baax pour dëkk bi yëpp waaye beneen tamit pour mu yombalal ko nit ñi ports borom bitig yi borom office yi banques yi ku mun di nekka yaa war a defar mu yomba pour nit ñi comme rang bi soo fa defee ay line nga wane ne 1 meter bi fii la 1 meter bi fii la nit yi na leen fàttalil ñu mun a taxaw even soo leen forcé wutee forcé bi boobu last resort la waaye mais bi nekkul ñoom seen wargal waaye ku nekka nekkuñ ci blame kenn waaye ku nekka mun ngaa def dara pour toog rek nga ne du ma mën a def dara everyone has a role to play so mun nañ koo yombalal suñ client yi su nekkee banque nga amee su nekkee municipality su nekkee ministry la foo nekk rek make sure nga am poti ndox ak saabu bu nit yi mun a raxasoo make sure su nekkee fu nit yi day ñëw jël service la comme ID card wala license nga make sure ne nit yi neen xam seen place fu ñu war a em si rang bi ak am ñeneen National Assembly for example soo fa demee toogu yi dañ si salante waaye dañ def effort si diggante toogu yi nekk beneen toogu bi ñu def fa ex soo ñëwee rek soo gisee di nga xam ne waruma toog fii den nga toog si nekk loolu rek dana may distancing ku nekk da ngaa use sa imaginative way booy use bu nga xam ne dina mun a tax mu taxal yombal yëpp ku nekk sa kër tamit soo nekkee si kër bi da nga war a try ñu def ba nga xam ne di nga ko yombalal waa kër bi pour ñu def social distance pour ñuy sori wante su ñoo lekka ñun ñëpp buñ ñëw mais bi groupe noonu comme nuñ def comme su Covid bi jotee comme weeri ko bi ñun ñëpp dañ dee toog nii ñu lekka tuddee mais bi su nekkee man maay borom kër bi naa xelaat ne waaw léegi since am nañ Covid 19 léegi naka laay def ba suma njaboot bi ñun ñëpp duñ toog nii di lekka di saxatante mais bi si Covid 19 bi ñu change loolu yow tamit di nga seet ne léegi xale yi naa leen defal ku nekk seen bool ñu toog or something yaay xelaat ñooñu dimbalee nguur gi pour ñu def ko so ñun ñëpp a war a am ownership bi second question bi boobu moom dafa am solo trop boobu ñun ñëpp suñu wargal la pour ñu seet naka leen fanxee feebar bi lii boobu dafa am solo trop nekkul pour Covid bi rek because loxo su setutee all the time lu mun a joxe ëpp na Covid mun naa joxe lot of many problems yu bari so loolu am solo la loolu wéer ak Covid bi ak outside Covid lu ñu war a bàyyi xel la so raxas loxo yi moom dafa important bala nga laal mbuuru booy jox nit ak mu fay teg mbuuru bi ak yooyu yëpp luy moom lu nga xam ne dañ ko wax ba noppi ba pare la because da nga war a make sure sa loxo yi ñu ngi set all the time so kuy dem di def that distribution dafa war a am maybe benn small butéeli lifin sanitizer bu ndaw so tuuti rek nga raxas soo laalee sa baari cycle bi ba pare bala nga laalaat nga raxas because soo laalee baar bi yaa ngi ko dawal fii yëpp den nga ñëwaat jël mbuuru yi noonu loolu is not good so loolu lu may digal ñooñu mooy comme que duñ mun dem di raxasu waxtu bu nekk ñu amee seen hand sanitizer suñ wàccee si bàyyi baari cycle bi o baari moto bi nga pare rek den nga apply quickly bala nga laal anything lu nga xam ne nit daf koo lekka incha allah.
Any additional question? Yeah. Okay, what follow-up question?
Yes, li ma doon laajte tam again mooy sànq rek lañ gis ci internet bi tam mbiru Africell te dégg naa ñu ko fi doon gërëm bu baax mooy xaalis biñ jël jagleel ko xeeti coronavirus bi ndax ci biiram tam amut ab sàggan wala ab xeebaande bi nga xam ne séntu nañ ko ci buntu jëwlu bi gàlloo wàllu wér-gu-yaram bu fekkee Africell ci boppam day dimbale ba noppi moom ci boppam mooy def ndimbal bi maanaam physically ñun ma xam ne xëy na yéen noonu ngeen ko war a def ndax fooguloo tam ne dina indi féewale ci seen biir ndaw yi parce que tey bu fekkee Africell mu ngi jox Samba Africell mu ngi yaakaar ne Samba frontline la te fekk ministre bi consider wut kooku comme frontline su boobaa ndax coow loolu du ci kaw ministre bi lay këpp at the end of the day.
so li ñoo njëkk a wax mooy ñu ngi gërëm Africell ak ñëpp ñu nga xam ne ñu ngi jàppale ministre bi moo tax ñu ngi leen a gërëm bu baax di leen sant lu gaay def ku nekk ñu ñoo leen oo ne ku nekk mun naa ñëw dimbale ba pare foo mun a dimbale rek fatal ñu fa rek ñun gërëm ne la sant ne léegi nag mun ne noo waxtaan pour gën koo jagal gën koo defar because Africell tey sax jógee neen fi am ne noo ñoom waxtaan yu baax and you know gars yi emuñ si lu ñoo def rek ba ñu ngi yokka many mën a other plan so ñun ñu ngi leen a gërëm di sant ba pare léegi yow soo xoolee suñ plan bi ñun bugga ne noo defal health workers yi yëpp dara so Africell ñëw leen feeñuñ si loolu so I think ñun amuñ dara pour wax leen lu dul gërëm leen sant leen yeneen things yu si xew yooyu ay discussion la rek yu nga xam ne dañ bëggoon a oo gars yi ñu waxtaan naka leen ko defee mu fit si plan bi very well te ñoom bu ñëwee everything went very well ñoom waxtaan bu set bu déggu ñu gis ne ñoom seen xol Gambians leen rek ñu nga xam ne dañ bëgg a gis nuñ supporté Gambians so loolu tax ñu jël xaalis bu bari bi dugal ko si health te soxla wuñ si dara so ñun as a health ministry defuñ dara lu dul di leen gërëm di leen sant waaye nu ñoo working out modalities yi yooyu leen doon detail out rek naka lañ ko defee fan la moo dem nuñ ko senee ak ñan I think nen isi details si more because right now ñu ngi def lot of works on the background comme ñu ngi memorandum ñu kontaan nen daal as a Minister of Health waaye we want to bring out those details su demee ba pare yëpp tey inshallah thank you.
Follow up to that. If the letter which has been circulated on social media is anything to go by, it really contradicts based on what you are saying, contact and things like that. It shows that you are even disappointed with Africell the way they are dealing with things. And above all, we know that this issue started at the RPPD, which is next door. Our main hospital. If someone has to go there, do whatever, talk to the media, up to the time that the individual have to travel right across the country, go to four other health facilities across the country. You said you are not aware of those moves. How best can Gambia believe such a statement? And above, secondly, on the same issue, we have asked the same question immediately when Africell did the first donation here at the press conference, where we pointed out some of these issues. That if Africell is doing it for 5 hospitals, hope there will be no controversy between you and your workers in other departments. But what we are being told here was these are phases. Everyone will be satisfied. Meaning it doesn't mean only the 5 hospitals selected by Africell will be the one to benefit from the Africell package. So in relation to that, is it that the way Africell did it, it shouldn't be like that, or how?
Yeah, so for us and Africell, like we said, we are grateful to Africell and we appreciate the efforts. This is people using their own resources coming to assist, and as a ministry, we appreciate it. Like I said earlier, we are just trying to work out the modalities on how it's going to go and what is needed and the details, and that we are in the process. And it has even become better and more improved. So about the other issues about the hospitals going and all, Yes, so you may be aware, but sometimes, it's just the channel. You may contact the right person and maybe the information did not reach and all those type of things. So that's why AfriCell were called and we discussed with them so that we hear exactly from them and have a very frank discussion, very fruitful discussion, and we agreed on terms and modalities that we are going to go ahead from here.
So far, did any health worker receive any, or nothing have happened yet?
So you were asking about other details also. Which are...
We asked here earlier during the first day of the whole issue, and we are told that everyone will benefit from the said package.
So everyone from the government, health workers, we have a package for them, for the health workers. But AfriCell, like I said, we've reviewed the discussion, we've reviewed everything, and then we are coming out with an MOU, which will detail out all this. And I'm saying that it's even better, and the discussion was very helpful, and it's more fruitful now for both the country and the health workers. Yes, I think that's it.
One final question from... You have a lot of things to do, so you just have to ask your questions. Yeah, tomorrow the minister will come, I drag him because they're working on a lot of documents so that we can do these things. So, yeah, tomorrow the minister will be here. Yeah, you have something to ask?
Yes, good evening. You mentioned in your statement that you really want to intensify efforts in creating awareness in two communities, that's Kusumbala and Bulun. Why those areas?
So thank you. That's a difficult one because from the risk communication and the problems we are seeing, it's not only those communities, but what we are seeing is that surprisingly, there's a big denial. You have people thinking that this COVID-19 is a hoax. It's not true. The ministry is doing it. And it becomes more worrying, even in communities, for example, where you have a suspected case or you even have a confirmed case, and there's too much denial around there. So I think it's good. I think the perception of the society, it's important. So that's why the risk communication is engaging this group. But we need to intensify what we are doing, especially in specific areas. Not only that, we are just starting, but we've gone to other, like they've gone to Sabbi, they've gone to other places, and we are going to, but now, because of the history of, you have a confirmed case, and they've gone to do a lot of work there. The same thing happened around Bundung before, and they went intensify, and people have gotten it. So this is the same strategy they want to use there also to ensure that the denial we are seeing is scary, and we want everyone to be on board to understand that this is true. And Minister has been saying it. Let's take it very serious. It's true. I mean, you can take our word for it. Really, it's a serious disease.
One final question for the day. Do you think we have a lot of work to do? Ask him. I drag him forever. Tomorrow the minister will be here. Any final question? Okay, ask your final question. Tomorrow you'll have another opportunity. No, let's not argue. Ask your question. The files are waiting for us. Gambians are waiting for us. We have a lot of work to do. You ask your question now, please.
The question is, around sometime in March 15th, there was a 3-month plan, budget, $2.5 million US dollars, which it is almost 125 million Gambian dollars. That was what the budget was stated was. What's the status quo? Because $125 million, but now 1 month later, less than 3 months, they have spent 143 million Gambian dollars. Tell us what's going on, please. What's the budget right now? What is going on with regards to the
So thank you very much. So I don't think it was March 15th. That was earlier than that when we brought out the first plan. first plan initially was just a 3-month plan, like you said, and it was around that $2.5 million. But soon after, around 8th March, then we brought out another plan which is more comprehensive, and that was 8.8 million. And now, even that, we are reviewing it because the COVID, like we said, keeps changing. Yeah, the plans keep changing. Like, for example, the common example I like to give is when we were doing the plan, we were not thinking of doing mandatory quarantine. We were going to do home isolation, which is cheaper. You don't need to have a hotel. You don't need all these public health officers stationed there. You don't need security if you do home isolation. But midway, we noticed that you have to do this. You need to do mandatory because that's the best method. So you have to change your strategy, and it has cost implications. Then, for example, you come to the projections. Initially the projections were not. Later you are having big projections of what will happen based on what was happening in the disease. Because initially, when the disease started in China, the fatality rate was very low. We're talking about 0.1. Out of every 1,000, maybe one will die. But later we were talking about 50. It's going to 5%, more than 5%. So then the case fatality rate changes, then in your assumptions, in your modeling changes, then you start to have big numbers. And so that will also translate into the equipment you are going to need. Initially, when we did the first budget, for example, the number of equipment for ventilators we put were small. Then when the projections change, you have to also change that. It also means, and these equipment are all expensive, and it changes your plan. So this plan is dynamic. It's not just going to be based on how much we are learning about the disease, then you change the plan. So your projections, if you're going to now have more patients, that means you're going to need more PPEs, you're going to need more consumables, and your plan will change. So at the present, we are on the process of, the review has been taxed on some people to start working on that, so that the plan is reviewed and it depicts what is happening currently in the country.
So the 143 million that has been spent, when will the public get out the breakdown on what this 143 million has gone into? The minister has said that the finance minister has said 100 was spent on Zhangzhanghu for ambulances and some equipment. And the 43 million was spent on local expenditure, which is on the feeding and the hotel. So, how many people have been quarantined to get an idea of what can you tell us on these 100?
But the quarantine is routine data that we give, like every day, how many total number of people quarantine and all that. So, for example, today, as of today, we said that 265 people have completed quarantine and 98 are in quarantine. Yes, 265 people have completed quarantine and 98 are currently on quarantine. So that is the number that has been quarantined. Yes, and then your second question?
The breakdown.
Yeah, so I think in due course you will get the breakdown because the things are procured. We are trying to get them because it's very abstract if we probably give you the breakdown like that. So, but when you see the equipment, then you can contextualize it. So, thank you.
Thank you very much. We'll work on everything. All the information will be available, and say this is an open government. Every day this is ongoing. You have the opportunity to ask your question, and all the information that you people are asking will be available in the public domain. On that note, thank you very much, Dr. Bite, for your understanding. I know I have to drag you literally from the office because we have piles of files that are waiting to be processed. Ladies and gentlemen of the Media Corps, thank you for your patience. See you tomorrow, the same time here. Thank you. God bless you.
ngeen fan la skincare la 2020 lañ wax de waaw fii nag mooy Kerr fan Kerr zero tache perfect skincare saa su ne rek niñ ko dee defee rek loo lañ soxlaati rek maanaam bu dee am problème ci seen skin yéen xam ngeen fan la fii ngeen di ñëw suma xarit yeeg am di jàmm yi nga xam ne taas daf lañ sonaloon xam nga doon xeesal ba la ka xum éneew ma lañ ko nag waaye just in case comme ni ko gars yi defee rek en cas just in case loolu xew xam ngeen fi ngeen di ñëw skincare plus si yu baax rek la ñoo dox nag ay baax rek fu ne la ñoo dem ci réew mi di lañ indi rek nag products yu baax du Paris du Italie du USA du fi mu nekk nii sax boole nañ ci nag Sweden fu nekk lañ leen a indilee products bu dee tamit nag da nga ñuul rek ñu lay jamaa natural beauty that melanin dripping we do have stuff for you as well emuñ si skincare products rek ñu ngi ci cuub yi tamit fu ne la ñoo jaar in fact sax last commercial bi ñu defoon waxuñ leen woon ne dañoo dox ci ay kawar 9A grade rek nag waaw we do have bundles as well hair si lu ne la ñoo dox ñun ñu ngi ci rafetal jigéen rek luy taaral jigéen rek waaw boo leen di tukki tamit bëggoon rek classic suitcase ñu dañoo dox ci ay Samsonite duñ dee indi any brand of suitcases though other than Samsonite comme li ma dee wax rek boo eggee airport dëri Samsonite dafa am nuñ laa xoolee waaw ngeen ne lan nag waaw skin ci moom la ñu gën a xamee nag skincare products ci moom la ñu gën a xamee ñu ngi dox tamit bentee tamit si ay dàlla man nag skincare mooy suma specialty xam nga rek jigéen bu sa xar kanam réglé loo def mu jag am nañ Patricia Reiner Kiwi Eye the whole range Lighten Up Gold Tomatine I mean the list can just go on and on and on and on lépp loo xam ne rek luy taaral jigéen la ci yooyu rek la ñoo dox skincare plus nag emuñ si Gambia rek ñu nga United States ñu ngi Gambia fii ba pare bu dee yaa ngi anywhere in Europe mun nañ la ko mail within 3 days rek ñetti fan rek nga jot say diw emuñ si loolu rek dañ laa consult tamit balaa ñu laa jaay diw dinañ def a free consultation pour wax la rek exactly li nga xam ne moo méngoo ak sa kanam dinañ leen wax tamit ne rek am nañ perfumes fragrances men's shirts accessories we do dresses as well we do blouses I mean we do shoes name it we do them Skincare Plus 2020 is our year of perfection zero task fi mu nekk nii réew mi fii kenn waratu fi task kenn waratu fi am problème kanam kenn waratu fi am problème picture boo ko amee dafa fekk ne rek ñëwuloo ci place bi fii
Love like fire. Bring my love like fire.
Stewart & Co. Solicitors, a legal excellence firm in London that can help you with all aspects of your legal work. If you are looking at immigrating to the United Kingdom, Stewart & Co. can help you to set up business, buy houses in the UK, and will deal with all your legal works from start to finish.
For all your general immigration work, we can help you with that as well. If you apply for any form of visa, whether student visas, settlement visas, marriage visas, or a child wanting to come to the United Kingdom to settle with the family, we can help you to achieve your goals.
Stewart & Co. Solicitors, a legal excellence firm specializing in conveyancing, immigration, litigation, family law, personal injury, licensing, no win, no fee. Contact us today at www.sk-solicitors.com.
Yo, ini bara. Okay. Welcome. Basically, lot of lala me along is cool, man. That I can really relax. What the madam? Yeah, that's what the madam? Yeah. Let them do somebody. That's right. That's fine. Slowly. Yes. No. Yeah, actually, a lot of people are basically me alone because they relax. So it's always kind of like an amazing Nina Fanny say what? Nidia, Nena Grand Villa is the best guest house in the Gambia.
Beji andika Grand Villa Guest House. Na labungol bebe senioring adum na bungol bebe nyarandiring coming ibe la fila ila suwe taranyame. Ntel Grand Villa na kiliano la lafino wale mukanwatin telkang. Na ye sabati Grand Villa ye la kodo na fa kalamuta.
Oh man, this is like a paradise. I know. I so much love this place.
Thank you.
Trust me, I love this place.
You can move somebody and watching one.
Yeah.
I know to Gambia. Grand Villa.
I tell you. I love this place. Okay. I love this place, man. Oh yeah.
Ni lefta na kuo keso sotola. Futama Oljuntum Paradise Estate. Mbaya kumandiroke 7527-218. Wale futana website auto www.grandvillaguesthouse.com. Grand Villa Guest House.